President Donald Trump coming under fire again, this time for speculation about unconventional COVID-19 cures or treatment, including UV light and ingesting disinfectants. He made the comments during last night's coronavirus task force update.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number on the lungs. So it'd be interesting to check that, so that you're going to have to use medical doctors with. But it sounds interesting to me.
Lysol and Dettol have responded to the U.S. president's comments about the effectiveness of injecting disinfectant to fight COVID-19. The manufacturers of the cleaning brand Reckitt Benckiser are pleading with the public to refrain from ingesting or injecting their toxic heavy-duty cleaning products, saying people should please read the safety information. COVID-19 continues to hit the U.S. hard. The number of infections now standing at 850,000. The death toll nearing 50,000. However, officials have been forced to rethink the timeline of when the virus began to pop up in the country and claim American lives. New information suggesting COVID-19 may have been circulating earlier. A 57-year-old woman died in early February in California. That's 3 weeks before the initial first reported death. Let's go to Lenny Bernstein, health reporter who has been covering the outbreak for the Washington Post. He joins us now to talk some more. Lenny, 50,000 is the number you're closing in on in the U.S. It's unbelievable. I mean, what are people saying? What are the American politicians saying about this?
Well, the American politicians say a variety of different things. You have the governor of Georgia moving forward with reopening his state. You have the governors of many other states saying this is absolutely not the time to do that. Most people understand, the public understands that we have a national tragedy, one that is continuing, one that we're perhaps only in the middle of, with many more months to come. 50,000 in the space of 6 weeks, as I'm sure you know, makes COVID-19 the leading cause of death in the United States at the moment.
So, Lenny, the first models that were revealed by the federal government, the White House, showed a death toll of over 100. I think it was like 140,000 dead if they were going along the same lines of restrictions they are in now. Have they shown any other updated models since that time?
Models are all over the place. The president was very encouraged a few weeks ago that maybe we'd only have, 60,000 deaths as a result of him closing off some travel from China. But I think as we see this proceed, it's becoming clear that we will exceed that number. Remember, 50,000 does not include the people who are dying at home, who we have yet to count, who someday we will add to the death toll. And we always knew this virus was spreading in our society before February 29th, when that first death was registered. It's just that we didn't have any testing here in the United States, and so we didn't know how extensive it was. Well, now, unfortunately, through the death toll and other means, serological testing, we're getting a taste of exactly how widespread this virus was before we took our first steps.
So where is testing at this point across the U.S.?
It's a quilt. It's a crazy quilt. Some states test a lot. Some states test a little. Some states are moving towards serological testing, so you can tell if people have the antibodies, and you can let them maybe back into the workforce in a limited way. Other states are not doing that. It's all over the place. It's 51 separate responses, counting the District of Columbia, with just a minimum of guidance from the federal government. You're kind of at the mercy of that. I'm here in the Maryland suburbs outside D.C., and I am at the mercy of what testing is available here. That will determine my future over the next several months.
Let me ask you quickly. You mentioned Georgia beginning to reopen. That starts this week. Are other states going to follow? What has the response been to Georgia beginning to reopen?
Well, if you recall the last couple of days, first the president said this was okay with him. Then he came out in a press conference and said he disagrees with the governor of Georgia and that he thinks he's going too quick. So it's really the governors. The governors are going to decide based on science, based on the states of their economy, based on essentially what they want to do. There is very inconsistent guidance from the federal level. And what you're just hoping is that you're living in a state where the leadership is not going to endanger you any more than has to be in the middle of this pandemic.
Lenny Bernstein, I got to leave it there, sir, but thank you for joining us. Appreciate your time today.
Great to be back. Thanks.